This is a Guide Your Light network production, creating podcasts with purpose.
Amazing that you can show that in these chronic complex diseases, just by removing some of the bad stuff from your body can start healing itself. So imagine if you remove some of the bad stuff and then you add the good stuff. Then that's really where this stuff comes together and changes a lot of people's lives.
Welcome to the Things You Can't Unhear podcast. I'm your host, Maritza Barone. Get ready to hear moments that will help you to see the world differently and inspire you to become the happiest, healthiest, and kindest version of you. What if everything we thought we knew about aging, illness, and human potential was about to change? Dr. Adeel Khan is at the forefront of a medical revolution, one that doesn't just aim to treat symptoms, but to regenerate, reverse, and completely reimagine what it means to live a healthy life. A world-renowned expert in regenerative medicine, Dr. Khan is pioneering the use of stem cells, gene therapy, and advanced anti-aging treatments to help people not only to heal, but thrive well into their hundreds. He's the go-to doctor for some of the world's most highly performing athletes, global thought leaders, and celebrities who want to defy traditional limits and unlock their body's innate potential. As the founder of Eterna Health, Dr. Khan is making cutting-edge therapies more accessible for those who are seeking vibrant health, longevity, and a whole new approach to wellness. If you're curious about how to live longer and better, look and feel incredible, and stay ahead of the curve when it comes to longevity and performance, this episode is your blueprint for what's possible. Welcome, Dr. Adeel Khan, to the Things You Can't Unhear podcast.
Yeah, thanks for having me.
I think one of those celebrities is Tony Robbins, isn't it? You worked close. I heard him giving you a testimonial recently online. I was like, that's quite impressive.
Tony is one of those people I looked up to since I was like 18. So it was really cool to treat him and get him to actually, I guess, endorse me in a way too. And yeah, and he's always on the forefront of looking for the best of the best. So hearing someone like that say something positive about you is really surreal.
Absolutely. I can imagine. Yeah. And his endorsement was that you said it yourself. He's at the forefront of this research. He's so interested in it, but you're teaching him so much that he didn't know. And you've been this wealth of knowledge. It's so exciting, regenerative medicine, really.
Well, that's the thing. I think medicine is moving so quickly, and especially this field. And regenerative medicine, I'm sure you're going to ask, what is it really, right? And it's really this concept of your body being able to heal itself. So instead of having to cut something out or instead of having to take a pill, we want the body to repair itself naturally and using the right tools, signals, or stem cells or whatever we may need to put into it so the body can heal itself. And there's so many different ways to do that.
Tell me about them, because these tools are coming up in the world quite quickly. This new technology is something that we're so excited about. If we don't need to take a pill, and our body can heal itself, that sounds like a dream situation, really, doesn't it?
No, exactly. I think the concept really goes back to even something as simple as like fasting. Like a lot of people know that, hey, when you fast, it triggers what's called autophagy, which is like helping to repair your own body. So your body has these natural healing mechanisms, which a lot of people have known about since for thousands of years. But now we're starting to understand the science of how do we actually maximize these to our benefit. And so one of my favorite therapies, of course, is stem cells. Why? Because stem cells are the natural repair guys in your body. Their job is to fix things when things start breaking down. But why don't they start? What happens as you get older is that your stem cells become exhausted. So stem cell exhaustion, just like a carpenter who's working all the time, he's just going to get tired and eventually he's going to go on strike. And he's going to be like, I've had enough.
I think some of my stem cells are starting to go on strike.
Yeah, exactly. And they just don't, then they just don't repair the tissue like they once used to. And so, of course, then when you think about it naturally, then you're like, oh, wow. So we have these natural repair guys in our body. Imagine if we could harness them to fix the body and repair it back to the way it was before a disease state. So, of course, stem cells have had lots of excitement for decades, but it didn't really take off for many reasons. And the biggest reason stem cells didn't take off is the lack of standardization, meaning we couldn't reliably make a standardized cell population. And I can go more into detail afterwards, but the gist of it is that the technology now has improved so we can just have a better product to offer patients. And this is really the beginning of that era where regenerative medicine is going to become mainstream because the results are more consistent and because you actually have what's called a standardized cell therapy. So it's more like a drug, like it's reproducible in that sense. You know what I mean? As opposed to if I use your stem cells or if I use someone else's stem cells, then there's no control in terms of the standard of quality for each person. So now we can standardize them.
It's so interesting. It's not accessible to everyone at the moment, is it really? Like, it seems like a quite expensive modality to be able to use. It seems like only the big celebrities are being able to access stem cell therapy in what I've researched so far. Do you feel like this will change over time?
That's my whole
That's your
mission.
mission in
Yeah,
life.
that's
Great.
like literally, yeah, exactly why I mean, I know how expensive our treatments are at the moment, and it's not something I want to say that way at all. And the reason is anytime you have a new technology, it's always kind of the rich and famous who do it first and are the early adopters. And then over time, the price will come down because there's economies of scale, there's better manufacturing, there's innovation on manufacturing, and then also there's just more competition. And so as that happens, then the price will continue to come down. And I always say, the analogy I always say is like in 2010 when Tesla first came out, the electric vehicle batteries, right? The electric vehicle car, Tesla wasn't very good, but the batteries were quite expensive. And so a car that didn't go very far was very expensive, but people supported it because they believed in a vision for a brighter future where electric vehicles became the standard. And I
Yeah.
think that's the same vision a lot of these early adopters like Tony Robbins, who support me, and other celebrities. I think a lot of them know that, hey, this is the future I want for my kids. So I'm going to support this now, even though it's very expensive, but I think it's paving a way for a better future.
Yeah, right. All right. So stem cell therapy is one of the tools that you use. There's PRP that you mentioned as well.
Yeah, yeah.
Tell
There's
me a
some.
little bit about how they both work.
Right.
As
Yeah.
regenerative.
So PRP is just platelet rich plasma. That's where a lot of people have probably heard of vampire facial and different kind of applications too. Whenever these things go into cosmetics, I feel like that's when
That's when
that's
it
when people
blows
hear
up
about it. Yeah,
because we are
exactly.
obsessed with anti-aging
Exactly.
at the
Yeah.
moment.
Yeah. Exactly. And we could talk about how we're using the stem cells for the face. So, but basically, plasma. We just take your own blood. We centrifuge it in a basically we just centrifuge it, which is just spinning it really, really fast. And what that does is that concentrates the platelets. And the platelets are naturally in the plasma, but when you concentrate them, they act like little healing messengers. Now, messengers meaning they stay there for maybe like a couple days, and then they send signals to say, hey, start healing this area. But the signal, how strong that signal is what's going to dictate whether or not it actually works, right? And so PRP is a relatively weak signal compared to like something like stem cells. So that's the way you can think about it in proportion or in relationship to that. So it doesn't mean it can't work. It just means it works for certain things better than others. So you don't want to necessarily put your eggs in one basket. And it's good to have different tools. Like where we use PRP, for example, is acute sports injuries. If you're like an athlete, you like injured your hamstring and you need to get back to playing as soon as possible, then that's where PRP can be really helpful. And pretty much every sports doctor in the world offers it now. Like it's super accessible and it's more affordable, right? And whereas the problem with PRP though is again lack of standardization. If you take your PRP and I take my PRP, it's going to be different, right? But say you want to use it for a shoulder and I want to use it for a shoulder. The problem is our PRP, our platelet concentrations are different. We're different ages. We have different stressors. We have different bodies. So you can't standardize it. And that's a good thing about these stem cells now. You can standardize it, which means you have a donor, but you're isolating a specific cell population. So meaning you're only using one type of cell. And this is a special stem cell called Muse, M-U-S-E. And that was discovered in Japan in 2008. But they're very special because they can survive in the body better and they can turn into anything in your body. So meaning they can turn into skin, they can turn into liver,
Wow.
brain, kidney, whatever you want. They're like little chameleons, but they're non-cancerous, and that's what makes them very unique.
It's flipping everything we've known about
Mhm.
traditional medicine and turning it upside down. Can we so when we have stem cell therapy and PRP, are we using our own DNA? Are we using our own blood and our own
The
stem cells? Or are they
PRP, you're
donated?
typically using your own, but the stem cells, like you said earlier when we started the show, you're like, my stem cells are getting tired. You don't really want to use your own stem cells, right? If you think about it,
Right.
because they've gone through so many replication
So I need
cycles.
like a younger version of
Exactly.
myself
You
to
want the
give.
younger,
Right.
you want the younger, and what's the freshest source? Of course, babies, right? Umbilical cord tissue. We're not hurting any babies.
Yeah.
It's just after C-section birth, you're taking the tissue, the umbilical cord tissue, and you're isolating the stem cells from there. But again, you're not using all the stem cells. You're using this technology that was discovered in Japan, and you're isolating the mu cells. And that's very important because the mu cells is what leads to consistent results and leads to like a consistently good product.
So is this legal in every country at the moment?
No, well, mu cells were, even though they were discovered in Japan in like 2008, so it's been almost 20 years, and there's a lot of research on this broad class, which is called mesenchymal stem cells. That's kind of like the class that's been for over 30 years. But there's many political, I guess, reasons that this hasn't gone mainstream yet, but I think it's starting to. Florida just passed a law allowing for stem cells as of July 1st of this year, which will be one of the biggest states in the U.S. that's legally where you can legally do stem cells. So that's a really big deal.
And that's the only state in the US
There's
currently?
Utah and Montana as well, but those are
Right.
like small states, so I don't know if they.
And
But
Canada, where you're from?
in Canada, you can only do it under clinical trials. Same with Australia,
Right.
and so a lot of those places are still you're not allowed to do them for unless it's under clinical research. But then there's countries where I practice, obviously, like Dubai, Japan. There's countries in Europe that you can do them as well. So we have like a clinic in Lithuania, and then South America, you can pretty much do them everywhere as well. So like Mexico and all the South American countries.
So you're on a mission to make people live to how old?
Well, I
old
want
do you
them to live healthy and well until 120, I think, as a minimum would be ideal. But again, it's not necessarily about living longer, but what it is about is what's called compression of morbidity. So meaning there's no disease as you get towards the end of life. So you can just have because that's what happens, right? After people get into their 80s and 90s, they start getting all these chronic diseases. And age-related diseases is really what's putting burden on the healthcare system. So if you can reverse aging, then you can help with all these chronic diseases. And that's why this technology is really exciting. And I have patients all the time who say, if they're in their 60s or 70s and we do these longevity treatments for them, they'll say like, I actually feel 10, 15 years younger. And it's nice to hear that, obviously. And then of course you can help people with different chronic ailments like osteoarthritis or different degenerative conditions that come with aging.
We're more than happy to live to 120 if we look amazing, feel amazing, have energy. Our
Yeah.
minds are still active and healthy. Absolutely. You're right. It's when we're getting old and frail and can't be mobile. That's when things change. And, people listening now, they're probably like, there's no way I want to live to 120. But if you're living to 120 and thriving, absolutely we do.
Yeah, and that's becoming more and more realistic. I think one day, eventually, these treatments will be covered by insurance. I think that's like 20 years away. But in a world where that's happening and everyone's getting, let's say, these infusions of stem cells on a regular basis, I could see like a huge reduction in chronic disease and just general ailments and people living healthier and longer.
Yeah. And looking like you look at 60-year-olds now and they look like they're 30 years old and it's amazing.
Yeah, you're already starting to see it, right? And the
Yeah.
effect is only going to get better and more pronounced for like our generation,
Talk to me about Botox and the current system of how people are using anti-aging therapies compared to what treatments you offer and how we can
Well, I think first thing to remember is Botox is a toxin.
Toxin.
Yeah, exactly. So again, whenever we think about the human body, we want to think what's happening at a cellular level. This was something we couldn't fully understand before, but now thanks to advancements in technologies, we can actually understand what's happening underneath, not just superficially, but what's actually going down to a cell level. So what Botox doing is it's actually making the cells, especially the muscles, weaker. Weaker meaning that over time, then they'll sag. And then so that's why we always say like Botox is like a cult, because once you join, you can't get out. And
True.
and so, because if you do, you're going to pay for it, especially if you've been doing it for a few years. So why don't we do something that's actually going to make your skin cells healthier? So this is where the stem cells come in, and exosomes, which are becoming popular. Exosomes are allowed in Australia. So people are doing exosomes now for hair and face. So they're allowed for cosmetic applications. And exosomes are basically the soup that the stem cells grow in. So when you grow stem cells and you replicate them, there's a soup, and that soup is called exosomes. It has all the nutrients like anti-inflammatory signals and growth factors, but there's no stem cells. So meaning there's no foreign DNA or anything, so there's less restrictions or regulation on that. So that's why they're allowed in Australia. And but the sourcing of where you derive them from is important, and you can derive them from mu cells as well. So you can get what are called muse exosomes, and then those you can apply on your face with the mu stem cells, and we call it the mu cell facial. And essentially what it does, it slows down the skin cell aging process. So what that means is if you started now and you do it every 1 to 2 years, your face wouldn't have aged nearly as much as someone who's not doing it. Plus, you can also reverse some of the skin. You can actually see your skin become tighter. You have less wrinkles, and I've seen it on myself. I've done it quite a few times, but also on many of my patients. Like I've done it for some really big makeup. I don't know if you know Huda Beauty. We posted about with her. So she has a huge makeup beauty line, and but I've done it for many celebrities too. And more and more of them are starting to come to us because, and I think this is going to become the next big facial because they really don't want to use Botox or something that's synthetic or going to have long-term effects. People are always thinking about natural healing and what's actually going to be good for my body long-term.
One thing I've learned on my wellness journey is that simplicity is everything, especially when it comes to supplements. That's why I've fallen in love with Kylo Nutrition. They've taken the guesswork out of it all, and instead of juggling 5 different bottles, Kylo gives you that all-in-one support for gut health, sleep, energy, and even glowing skin. Their luxe science-backed super blends are not only delicious, but they're designed to support us without complicating our routine. So whether it's a super greens blend, a plant-based protein, or something to help you wind down, Kylo helps you feel your best from the inside out. And honestly, it's just made wellness feel so effortless. You can check out the full range at kylo.com.au. That's KAILO.com.au. And use the code TYCU for 10% off at checkout and a gift with purchase.
Looking at, obviously, regenerative medicine is challenging the pharmaceutical industry as well, right? Where do you sit with that? What do you think the biggest issue with
Well,
modern
I think
medicine is at the
I should
moment?
mention that that's one of the reasons why these treatments aren't approved yet in Australia or Canada or US because
This is where we're getting political, right?
there's no regenerative medicine lobby. There's a pharmaceutical lobby that helps to get those things across the board and approved and all that. But in Japan, there's actually a regenerative medicine lobby. There's lobbyists who help to pass regenerative medicine laws. So the regenerative medicine laws in Japan are like 10 years ahead of the rest of the world. We just need to copy and paste those, but because there's no one really lobbying for that, then you don't get that same forward thinking here. So that's part of the reason why they're not doing it here. And then I think part of it has to do with the lobbyists. But then the other big thing too is I think a lack of education too. A lot of doctors and a lot of the regulators who are involved in that don't understand that there's actually a lot of safety data out there. And there's also a lot of efficacy data too, meaning there's data showing how effective these cells or treatments can be. And again, you're also talking about conditions that don't have any other good treatment options. So if you were a patient and you're suffering with this chronic disease and you're told, hey, you can take this drug, it doesn't really work, but sorry, you have this disease, you have to live with it. And then there may be this option that's experimental, it's a bit new, but it's safe and it may be effective. Wouldn't you want to be able to have the right to try that as a patient?
100%.
So I don't understand why that, and that's what I think most people can resonate with that. So wouldn't you want these treatments to be more accessible? So I think the government and the regulators are really falling behind, and that's, to be honest, just making them look bad because more and more people are willing to travel for this stuff because they want to seek treatment, and they see all these other people getting better. So they're like, why can't I do it too?
It's true. And there is so much focus on medication at the moment when it comes to antidepressants or ADHD medication, conditions like that. Do you feel like regenerative medicine can work within some of these conditions also?
Yeah, for mental health, I mean, again, we have to look at the root cause, right? And so there's neural inflammation, right? In the brain, there's inflammation. There's a gut-brain axis, and then there is that chemical imbalances like the serotonin and dopamine. But that's not the whole driver, and pharmaceuticals really only focus on that. So we try to focus on the other aspects of the disease as well. And so if you can reduce neuroinflammation with these infusions of stem cells and exosomes, but one of the biggest intervention that we have that really helps with mental health is something called the vagus nerve injection. And basically, this is for people who have PTSD or trauma or anxiety or panic attacks. They go into that fight or flight all the time, right? They're in that fight or flight more than they want to be. They can't sleep properly, or they have these intrusive thoughts, whatever it may be, or if they have a bad history of actual unresolved emotional trauma. And unresolved emotional trauma is often the root cause of a lot of mental health disorders too, right? So, and there's a really good book called The Body Keeps the Score.
Yeah, I've heard
And
of
so it all talks, your body remembers, even if you think you've gotten over it, your body still physiologically may have this fight or flight response that you can't control. It's physiological. So we can do this procedure where we inject the vagus nerve, which is basically the gateway to your relaxation system. And we're injecting it with exosomes and peptides to help the signaling and for it to conduct better. So you're basically making this, you're restoring function to the vagus nerve. And then at the same time, you do what's called a stellate ganglion block, which is just using more anesthetic, which is a more traditional procedure to tone down the fight or flight response. So you're trying to bring balance back into the nervous system.
And have you seen promising results from
Oh yeah,
using it?
I mean, the stellate ganglion block's been around for 20 years, and there's a lot of research published on it. I just added this regenerative medicine twist to it, so to speak, which has been life changing for many people because it adds it has longevity to the treatment. So it's because then you're actually changing the physiology of of the cells. And so I've had patients. Actually, in fact, today I was just talking to one of the patients who was just her daughter. She was 14 and she had severe panic attacks and anxiety, and she said she was calling her 10 times a day before, and now since the V shot, we call it the V shot, the vagus nerve injection, and since then she has had like no issues, and she's basically in remission, and she's
And
done
one shot.
everything, just one injection, yeah.
That's
So
amazing.
your vagus nerve splits into two from your brain stem. So one here, one here. So it's a 2-day procedure. We do one side one day and then one side the other day, but one shot each side.
I mean, that's the dream, isn't it? When you've got a condition that you've had for so long and you can't find the cure, and then there's this magical cure that
Yeah.
not only it doesn't mask anything, it actually heals you from within
Yes.
using
Yeah,
your own
exactly.
DNA. And
Yeah, exactly. You're restoring cell function, right? You're restoring your body to function the way it needs to be. And I think you were telling me before we started the show how there was a patient who was able to heal her own cancer, right? And so that just shows you the body's ability to heal itself, but you have to give it the right microenvironment and sometimes the right tools. And now we're starting to understand that.
you mentioned too, right at the start of this, about fasting and how integral that can be for our body healing itself. And it's funny that you say that. My husband's just come off the back of a 3-day dry fast, actually. So he did
Well,
no water either. And he was revving out. Like, he had so much energy. And he said, I can actually feel my body just restoring itself from the inside. And he felt amazing. What else is up our sleeve when it comes to things that we've got just right at our footsteps that we can use from a natural perspective?
Well, I think one of the best things is, of course, high resistance exercise, high intensity resistance training. The reason being because that actually helps to boost your body's own. And we know exactly now what it does. Well, not everything, but what it does is it helps to boost your own natural killer cells and your own T cells, which are part of your immune system, basically. So it makes your own immune system stronger and better on surveillance and help to deal with chronic infections and help to mitigate the risk of cancer. And then also we know when you train hard, it also releases something called myokines. Myokines are like signals that get released from the muscle and they go to your brain, they go to all over your body and they reduce inflammation, they turn off genes that can turn into cancer, like oncogenes and all these other downstream effects. So basically it's your body's own healing mechanism built into you.
And that's heavy
You
lift.
have to do high intensity resistance training. There's no way around it. It's not pleasure.
Go for a walk on the
You can't just
beach.
go for a walk on the beach. No, it is not. That's not going to have the same effect. And the reality is, you can do it in even a 15-minute full body workout. If you do it efficiently, can still be enough to get what you need. But it has to be done with that intensity. It can't be like you're on your phone texting and then you're kind of just doing a bunch of leg extensions or something. It has to be like focused and hard. And it's those difficult reps that really have the most benefit on your health and longevity.
And the good news is it works 100% of the time,
Exactly.
right?
Yeah.
We know that consistent repetition of exercise that's
Yeah.
hard works 100% of the
Yeah.
time.
Yeah.
Amazing.
Exactly.
Tell me how AI has played a role in the technology that you're working with. Are you working deeply with new AI tech right
Well,
now?
there's so many applications right now in medicine, but in regenerative medicine specifically, the most interesting right now is they're working on a digital cell. So imagine if you could make a cell and model and like a digital version, and then you could test everything out on that cell
Oh, wow.
to know exactly what it would be, and not having to test it out on humans. So that's what there's an AI institute in UAE actually. They said they're working on that right now. So that to me is the most exciting thing in AI right now. For me personally, as someone in cellular medicine, if that actually takes off, that could be like world changing for so many different reasons.
Oh, that sounds like a dream. I think, people look at AI and they think this is frightening. It's going to change the world, but there's good and bad to everything, right? And you hear how much it's helping modern medicine.
Yeah, no, there was a biotech company I was just talking with last week, and they were saying how traditionally it would take several years for drug development, and this AI tool that they have now for drug development was able to do it in a few months. So that's a lot of people's jobs potentially gone, which is I think the thing people are scared about. But at the same time, it can accelerate discovery of new drugs and new molecules and help a lot of people faster.
And create new jobs in different
Exactly.
avenues at a
Exactly.
different level.
Yeah.
It's something that we need to be cautious of. Just keep our eyes open, but use it to our own benefit.
I think the good thing for people now with when it comes to health and even regenerative medicine is you can talk to one of these GPTs, right? And you can ask it, be like, hey, which regenerative medicine cell therapy do you think is the most promising? And then you can simplify it to me like a 10th grader. You can, and you can use it for learning. And I think that's really the biggest tool right now. It's like, there's no excuse not to empower yourself with knowledge because you have an Einstein in your pocket, basically.
Yeah, it's so fascinating. So you're here at the Kylo Summit. You're presenting tomorrow at the full day summit. Tell me about what you'll be sharing. Is it more about stem cell and regenerative health that you're?
Yeah, no, it's kind of the whole picture of how we get your body to heal itself. So we're going to be talking about stem cells, about gene therapy, about peptides, and then one of my favorite topics at the moment too is what's called subtractive medicine. So subtractive medicine is removing the bad stuff from your body. And what do I mean by bad stuff? Microplastics, heavy metals, toxins, particulate matters, all things that build up, especially microplastics. Our body has no mechanism to get rid of those. So those just build up over time and they kind of hijack your immune system and can be one of the risk factors, let's say, for chronic diseases. So there's technology now. It's one of the world's most effective technology for removing microplastics. And we're putting that in all of our clinics because it's so exciting and it can help so many people. And they've already used it for long COVID and they've even used it for Alzheimer's, so for showing how it can slow down progression of that, which is pretty, again, amazing that you can show that in these chronic complex diseases, just by removing some of the bad stuff from your body can start healing itself. So imagine if you remove some of the bad stuff and then you add the good stuff, then that's really where this stuff comes together and changes a lot of people's lives.
Wow, it is fascinating. Is there anything that we need to be cautious of when we go out and research this information or find a practitioner that might be able to help us? Is there anything that we need to look out for that
Well, I think
might
with
be dodgy?
practitioners, you want to make sure they're involved in some sort of research because yes, there is a lot of, let's say, predatory stem cell clinics. And
Yeah.
that's a problem with this field is that, and that's part of the reason I went into it because I want to do it in the right way and try to be as honest and open about as possible, saying, hey, this is new, but there is real data here and this is something that can help a lot of people. And so for people just looking for practitioners, just make sure you find someone who's actively involved in some sort of scientific work or research. And for me personally, that's where I've learned. I've learned from the scientists in Japan, scientists in Europe, scientists in North America. I've traveled all over and learned from different scientists around the world. And that's how I've accumulated my knowledge.
I know there's going to be people listening saying, how do I get a consult with this guy? I have to ask the question. So do people need to come to Dubai and have a consult? Are you
I do
doing
it virtually.
consults? You do
So yeah,
virtual
so
consults.
our team is pretty good at sorting all that out. And although I'm seeing patients less, but I do still see patients, I guess. But there are other doctors on my team as well. But yeah, but if they just inquire virtually, then they can get a consultation pretty easily.
And are you doing consults while you're here in Brisbane?
We're seeing some patients. Yeah.
Amazing.
Yeah.
The lucky few.
Yeah. You could put it that way.
Well, those special people get to live to 120 with this incredible work that you're doing. Absolutely fascinated with everything that you're bringing to the world. Thank you, I suppose, on behalf of everyone who is able to be on the other side of the receiving side of what you do for everyone. It's fantastic.
Yeah. Thanks for having me. And I'm excited to speak tomorrow.
Oh, well, I can't let you go just yet because the title of the podcast
Ah,
is called Things You Can't Unhear.
yes.
And so I do want to hear a bit of a things you can't unhear moment that you had in your life.
Yeah, one of my favorites was when you want to succeed as bad as you want to breathe, then you'll be successful. This is from Eric Thomas, who's one of my favorite, let's say, Tony Robbins type personalities in the world. And I love that one.
And what does success mean to you?
It means having the biggest impact on as many people as possible.
That's amazing. Oh, I can't wait to see you just continue to grow and shine. Thank you so much, Dr. Adeel Khan.
Thank you.
Thanks for listening to the show. What did you think? And what did you feel? Let us know by leaving me a message on the Things You Can't Unhear Instagram community page. And if you can, give us some ratings love on your favourite listening platform.